Hey everyone, it's my pleasure to welcome you back to my channel. If you're new here, my name is Nguyen. I'm a rising fourth year medical student at the University of Illinois College of Medicine in Chicago, and I make helpful videos to help med students, pre-meds, and everything in between. So this video this week will be continuing on our series on how to crush and get an outstanding/honors on all your clinical rotations featuring family medicine today. So on the family medicine rotation, like my other videos, I'll be breaking this into looking at the shelf exam first and then the clinical rotation afterward and offering some advice that they will help all of you as you prepare for this rotation and specifically this clerkship. If you haven't seen my other videos yet, definitely check out my videos on internal medicine, surgery, neurology, and psychiatry. It's all posted on my channel, and I try to be as transparent as possible and give you as much advice and tips to help you go in confidently and crushing your rotation the best way that you can. So as you can see on my grade transcript here, I've earned outstandings in all of my rotations thus far, which is the highest possible mark, and it's equivalent to an honors at what other schools might call it based on their grading system. So overall, I hope that my advice can be helpful to you, and of course it's always based on my own personal experiences, but overall feel free to comment anything below and I'll be happy to answer it. And hopefully this can get you all started on doing really well in your family medicine rotations and all your other ones you'll have throughout your year. So without further ado, let's get into it. So my family medicine rotation was 6 weeks long, and like all the other rotations, your final grade consists of your shelf exam score and then your clinical evaluation. So we'll start with the shelf exam score to get you started on the right foot to making sure you crush this rotation. So when it comes to the shelf exam, like all my shelf exams, I recommend using Anki and UWorld questions. And I already go over exactly how to set up Anki in my new video called Everything You Need to Know About Anki in Just 15 Minutes. I highly recommend anyone interested in using this program for step 1 or step 2 or shelf exams to check out that video. I'll link it right up here. In addition to that, I've already made videos on exactly how to use Anki for step 2 when you're using the pre-made decks and how to find the exact cards to do with every rotation. And I highly recommend you check that video out because that's all the studying I've been doing for all my rotations. So definitely check those videos out. And in this section of today's video, I'll just be going over some additional tips for the family medicine rotation in specific. So something I noticed with family medicine is that a lot of the questions and a lot of things you'll see clinically are based on the USPTF guidelines, which is the United States Preventative Task Force guidelines. And this just tells you like how often someone should be getting a pap smear, how often they should be getting their blood pressure checked, their LDLs, and things like that. So making sure you know all of that will be really helpful for your exam and when you're on your outpatient services. So there's an Anki deck that I use in addition to everything else that I previously just mentioned, and it's called the Hugi Med Anki card deck, and it's only 69 cards, basically just a flashcard deck of all the USPTF guidelines. And these flashcards, some of them are repeats from what's already included in the pre-made Anki decks, but I thought this one had some ones that weren't in the other Anki deck, and also it was a nice little refresher that you could look at the night before your shelf exam. So I would recommend just going through those cards the day before your shelf exam or 1 to 2 days before. That's what I did, and it actually yielded me a couple questions on the test that helped me get those right, which I thought was really helpful. Other than that, that's really all I had to say about the shelf exam. I thought it was pretty representative based on UWorld and everything that I discussed in my other videos. So definitely check that out if you're someone that's having more struggles with the test taking portion as opposed to the clinical evaluation portion. Now for the clinical evaluation portion, this is going to be different depending on where you're training in the country, what site you're at, and there's so many differences that can occur, but I hope my experiences and little pearls of advice can really help you out no matter what clinical setting you're in. So to start off, I would say that the way my clinic worked was generally like 2 half days. A morning clinic around 8 to 12, you would have an hour off for lunch, and then the afternoon clinic was 1 to 5. Now an hour for lunch, that sounds like pretty nice, right? But honestly, most days you're really only getting like 15 to 20 minutes because I've noticed with family medicine, the clinic is always running late just because patients come late. It takes a while to room the patients, and then seeing the patient, working up everything they have going on, and making the note for it takes a lot longer than what's allotted, so you're kind of always running against the clock. So it's something I noticed right away with family medicine is you actually don't have that much downtime. You're constantly kind of doing work. But I would say in between patients, you do have a little bit of time, usually 15 minutes or so. So you can really take advantage of that time to review, study, and also just prep for the next patient so you're doing really well. So what I recommend for you is always pre-chart. So before the patient comes in, you can see the list of patients coming in that day. Make sure you're pre-charting on the next patient coming in so you know exactly what they're coming in for, what their chronic medical problems are, just so you have a better idea, because it'll make your time in the room with the patient way more efficient, and you'll know a lot more when you're presenting to your resident or attending. For the most part, a lot of these patients in family medicine, the physician, like the resident or attending, has been seeing this person or their family for many, many years. So they already know a lot about the patient, and you've never seen this patient before. So making sure you read through the chart and getting that head start will be really helpful in your presentation, how confident you are, and I think that'll just help you overall in your clinical grade. So once you pre-chart and you go in the room, just talk to the patient like you would any other rotation, get their relevant history, and then make sure you follow up on all of the other problems that they might be going on, like if they're taking their medications, any chronic conditions they have. And a couple things I feel like I found myself forgetting a lot is that when you're meeting with female patients, don't forget to ask them about their last pap smear, if it was normal or not. Don't forget to ask about sexual history, family history, any new cancers, and things like that. I think that's helpful, and when you're doing a presentation in family medicine, it's sort of like internal medicine. You're going to want to present everything, like their social history, past surgical, past medical history, medications, and all of that. A couple things you can do to be extra helpful, I would say, is that you can do some medication reconciliation while you're in the room with the patient. So making sure you have an accurate list of what medications they're actually taking and what dosages. I find that sometimes those are out of date. Some other tips I'll have is that if you're using Epic, which is an electronic medical record, when you're in the room, you can start typing the note as the patient's saying things. It'll help keep you more organized. And in addition, Epic has something on the left-hand side called care gaps, and that can let you know if this patient needs a certain immunization or they're not up to date on a certain screening test, which can help you remember if this patient might need a mammogram, or this patient needs a pap smear today. And a lot of that you'll be able to present in your assessment and plan when you're giving your presentation to the resident and attending, so that'll make you look good as well. So in regard to presentations, it's really just making sure you're clear and concise and actually come up with an assessment plan. Like today, we're addressing these 3 things, and this is what we're going to do for those 3 things. We're going to order a pap test, we're going to order this blood level, and make sure it's very organized what you're going to do, and have a very evidence-based assessment and plan. And what I mean by that is once you're wrapping up in the room with the patient, you're wrapping up the note in the room, go back, and I'd recommend going to UpToDate or whatever resource you like to use the most, and making sure you know what the plan should be and what the dosages are. A lot of times I feel like when I've had a perfect presentation and I know exactly what the plan would be for this patient, like I'm going to start this new medication, the one question attendees can always get you on is what dosage do you want to start with. And a lot of times as medical students, we just know what medication we should use, but we're not really sure in terms of dosages. So I would say having that in the back of your mind and looking that up beforehand can really help you stand out. All in all, I really enjoyed my family medicine rotation. I found that most of the time you're sort of acting like a triage person, because the clinic's always kind of running behind, and if you can see a patient before while the resident's wrapping up the previous patient, you can just help streamline the process. So as soon as the resident's done, go and staff with them and be like, all right, so I have this other patient, room 6, 44-year-old female, XYZ. And if you just are working hard, keeping the clinic working smoothly, I mean, that's the best way you can help the team, help patients, and I think they also notice that in terms of evaluations and all of that. So that's another piece of advice I have for all of you. But overall, I think you're gonna do amazing. Family medicine tends to be a little bit less work compared to rotations like IM or surgery or OB. So hopefully this is a good rotation for you to catch up on some sleep. It's less high stakes situations. Everything's done pretty routinely, outpatient, and I think it's an enjoyable experience to see all the different presentations there are, and just being able to see a lot of families too, because before I did family medicine, I almost never really saw kids because I haven't done pediatrics yet. So that was a nice part of the rotation. I would say my last piece of advice is just, again, if you're using Epic, focus on the care gaps, but also you can use the dot phrases and the smart tools to your advantage. If you're not really familiar about how this works, just talk to one of the residents about it, but I'm sure you've used this in other rotations. I used it a ton on every service so far, but try to find a resident you're working with and ask them if they have any recommended smart tools or dot phrases that they use, because trust me, all residents have a go-to like well visit smart tool dot phrase or well child visit, and it pretty much has all the questions that you need to ask the patient. So if you have that auto-populated, you really can't forget anything. You'll be getting all the information that the resident would have gotten if they were in the room themselves, and that helps you be a really effective medical student, and it'll help you crush this rotation. So overall, if you have any questions whatsoever, just let me know. I'm happy to answer them. I know you're going to do amazing on family medicine and all the rest of your rotations. Thanks for tuning into the channel. I hope this was helpful, and have a wonderful day.